right. Dr. Al Dannenberg, thank you so much for coming on the podcast. It's a pleasure to have you here, my friend.
Oh my goodness. Thanks for the invitation. Here I am too.
Here we are. So we are going to cover so much in today's podcast. I talked a little bit about your bio in the introduction, but let's just start with your story because it's a very remarkable one. And I think that your story of integrative, nutritional-based biologic dentistry leading to your own health issues will be a great jumping off point for so many of the things which we're going to cover today. So let's start there. Let's start with your story in a nutshell, and we'll go from there.
So my story is, first of all, I'm 73 years old. So you got to understand that. So I go a long way back. I was practicing periodontics for 44 years. But at the age of 59, I had a stroke. And I had this stroke. I had no idea why. I was 5'7" tall, so 5 feet 7 inches tall. Obviously, not a tall guy. I weighed about 187 pounds, so I was kind of chunky, I guess. I didn't realize that. I ate a lot of great food, lots of carbs and sugar and cakes and cookies. I thought I was healthy. I jogged a little bit every week. I thought I was okay. I had a stroke. Obviously, I wasn't okay. My conventional doctors saved my life. They put me on 7 medicines for the rest of my life, and that didn't cut it for me. And I asked them, why did I have this stroke? What's going on? They had no idea. And then they said, just eat healthier and have a healthier lifestyle. Well, what the hell did that mean? So I needed to do some research. So I went to the organizations that I thought could give me some direction: the American Heart Association, the American Cancer Society, the American Diabetes Association. I thought they would give me the information I needed. Now, here, I'm a healthcare professional. I had no training in nutrition or lifestyle in dental school or graduate school. I'm a periodontist. And then I'm looking at these medical institutions that should give me information. So I listened to them. I did what they told me to do. And let's fast forward from that point of 59 to the age of 66. And I was doing everything that they were suggesting to do. I maybe lost 4 or 5 pounds. I was still on 7 medications. I'm leaving from Charleston to go to Austin. I have to travel through Atlanta Airport, which is big. And I generally carry my bag on my right shoulder and walk from the concourse to concourse if I have enough time. So I did that. And I started to develop pain in my right shoulder, which is very unusual. And that pain kind of lingered. I went to the meeting. I did my talk, went home. Everything was okay, except the pain just was annoying. And then it went to my back, then it went to my chest. I'm a little hard-headed, so it took a little while before I got to my physician in August of 2018 to see what's going on. And he looked at me, he said, yeah, you got some soreness? I said, yeah, I got some soreness. Did some blood tests. Everything that he did, standard blood tests, CBC, chemistries, everything came back normal. He did another blood test at the same time, which is the HSCRP, high sensitivity C-reactive protein, which indicates some kind of systemic inflammation. It doesn't say where it's coming from, doesn't say if it's acute, doesn't say if it's chronic. It just says something's wrong. And it was high. It shouldn't be high. It's never been high for me in the past. And he said, let's do an MRI. We did an MRI. Results come back. He calls me on the phone. He says, Al, do you want to come into the office or talk on the phone? I said, how bad could it be? Just tell me what's going on. He said, first of all, did you fall down some stairs or did somebody beat you up? I said, of course not. I just was carrying a bag on my shoulder. I think something is torn. He said, you have two cracked ribs, a vertebral compression fracture, and a crack in your right side of your pelvis. And I think you have either lymphoma, leukemia, or multiple myeloma. Wow. Now, here I am, 71 years old, thinking I am the pillar of health. And I feel like the pillar of health, except I have some chest pain. And I'm getting this diagnosis or the series of diagnoses. So he brings in an oncologist. We do a PET scan. As you know, a PET scan is a CT scan, three-dimensional kind of thing that they inject a radioactive glucose solution in your vein, and any cancer cells eat it up, and the CT scan glows where the cancer cells are. So we do that. There's a mass on the side of my spine. We do a CT biopsy of that, and a bunch of other chemistries that are very significant for cancer. And my wife and I, my two adult kids, are in the room of this oncologist who I am meeting for the first time. And he's a great guy, and he's my oncologist today, and he's a conventional oncologist, and he tells me I have IgA kappa, light chain multiple myeloma, with innumerable lytic lesions in my skeleton. So there are a lot of forms of multiple myeloma, but one of the ways to describe multiple myeloma is how many holes you have in your bone structures. And it may be one lytic lesion, two lytic lesions, five lytic lesions. The radiologists couldn't count them all, so they said innumerable. I have a skeleton that is like a person with severe osteoporosis. And I have severe risk of fracture, pathological fracture. And that's what happened without me knowing, breaking bones, and that's what caused my pain in the chest, which at that point was pretty severe. And he said, and this cancer is incurable. There is no cure today for this cancer. He said, but we have good news, and we want to get you on chemotherapy right away. This cocktail chemotherapy will probably put you in remission. You're really not a good candidate for stem cell therapy. You probably do bisphosphonates to help your bone structure, and you'll go back and you'll get in remission. And I said, well, then what happens? He said, well, unfortunately, the disease is going to come back. We'll need new chemotherapy, more caustic because the previous wouldn't work any longer. And eventually, none of the chemical drugs will work, and you're going to die from the complications of multiple myeloma.
And this was when?
2008, September 2018. He gave me 3 to 6 months to live at that point.
3 to 6 months to live in September 2018.
Right.
And
you kind of imagine, I mean, what would go on in your mind if you got this diagnosis and prognosis? So I have to make some quick decisions, and I'm trying to create some quick questions to get some sensible answers. And my oncologist said that my quality of life would constantly decrease during all this chemotherapy, but it would get better once I was in remission, but then it would go down again. So I'm the kind of guy that I don't mind, and I have no problem dying. I just have a problem with debilitation over time, and I don't want to live in a decreasing quality of life. Like Mark Sisson says, live long and drop dead, or something to that effect. I just want to live with a quality of life and drop dead. If I'm going to die tomorrow, okay, but I don't want to die 2 years from now with such a terrible life quality for that period of time. So I said, I'm not going to do chemotherapy. Just not going to happen. And I said, I need to do some research to see what other options that are out there in the alternative world. And then at the age of 66, I found a course in nutrition for healthcare professionals at the Kripalu Center for Yoga and Health, of all places. Phenomenal course. I thought it was going to really hone everything for me and just summarize what I learned. So I went to this program, and I learned that I was doing everything wrong. And I learned about primal nutrition and primal lifestyle, which I had no idea what those terms meant. But after 5 days, I learned it. So when I went home, I called my wife before I got home. I said, I want to make some changes. When we got home, she and I batted heads a little bit. And she said, I'll give you 30 days. So we cleared out all of the non-paleo type foods in the house. So we removed foods from the refrigerator, the freezer, the cupboard, and we had 7 bags of groceries we delivered to our local food bank, and we had no food in the house. So we went out and started shopping for wild-caught animals and fruits and vegetables and nuts and seeds, everything organic. Basically became paleo. And I started to integrate some of Mark Sisson's concepts with lifestyle, exercise, that type of thing. I started to do that. And within 2 years, from 66 to 68, I lost 30 plus pounds. I got off all 7 medications. I felt phenomenal. I really considered myself the senior poster boy for a healthy lifestyle. And I started to incorporate all these concepts in my treatment for periodontal disease. And the patients that accepted this, and there are just a few patients, obviously, because, you know, what does a periodontist know about nutrition and health? But a few people actually listened to what I suggested, and they got so much better results. As a matter of fact, once I changed their diet and they understood changes in their lifestyle, we could treat active gum disease, not severe gum disease, but active inflammation, and gingivitis certainly, without any oral treatment in their mouth. Just diet changed it. So my wife, smart enough, she's a phenomenal pillar of my life, and smart enough, she deals me some tough love. And she says, you know, you've been a survivor all the way up to this point. You are not a victim. Get your head together and get back on your protocols. It really served you well until this accident in the bathroom. So she brings in a physical therapist. They work with me. The catheter comes out. I start walking a little bit out of the bed. Eventually, within 2, 3, 4 weeks, I'm outside and walking with a walker. I go to my oncologist, and I'm really doing fine. And I revoke hospice. At that point, my oncologist realizes that there are 2 new immunotherapy drugs that are recently approved for my disease, and they are not chemotherapy drugs. They are human-derived monoclonal antibodies to help take care of my cancer cells and the damage of my bone structure. And I now incorporate that into my unconventional cancer protocols. So that is now in October of 2019. And we can kind of move forward. I'm continuing to tweak my protocols, and we can talk about diet along the way too, if you want later on. But then it comes to May of this year, May 8th, 2020. My oncologist wants to see how my cancer cells are doing. Again, I'm staying relatively stable with blood chemistries. And so we do a new PET scan. So the first one was when I was diagnosed. There was a second one in sometime of June 2019 that showed lots of cancer. And now this one, May 8th. So I do this head-to-toe PET scan, and he calls me that evening and says, Al, get your wife on speakerphone. So I do that, and he reads the radiology report, and it basically says there is no active cancer cells throughout your entire body. And I said, there was a pause. And I said, George, read that again. Read that again. I want to make sure I'm hearing what you're saying. And he is telling me that there are no active cancer cells. So I am literally floating on air. And he's shocked. He has no idea, didn't have any idea that that was going to be that positive. And the reality is I'm not in remission and I'm not cured, because PET scans are only as efficient as they can be. So they only can see moderate to severe clumps of cancer cells. I can't see some of the cancer cells that are floating around, and I still have a little work to do, but I am doing extremely well, and here I am, and that's my story. And I feel great for a guy that should have died in December of 2018.
Right. And yeah, and there's a very interesting piece of this that you left out, Al.
Tell me.
Tell me about how you've been eating for the last 5 or 6 months.
Oh yeah. So let's start off that when I did my course in Kripalu, I started paleo. So the age of 66 to when I was diagnosed, I was a paleo guy. When I was diagnosed in September 2018, I did paleo, but I went more autoimmune. So I cut out nightshades, kind of, things that may be triggering an autoimmune reaction or a a cytokine type of reaction. So I did that, and then I did some phenomenal research. There's this guy, his name is Paul Saladino. You may not know him, but he has this website. God, I'm Carnivore MD. Who'd have thought it? So I started looking at things like that, and I found this website, and I started to read about the carnivore diet, and maybe it's got some interesting ideas. And then I'm posting blogs every week about my cancer journey since I started on my website, and people are responding. And somebody mentioned this crazy clinic in Budapest, Hungary called Paleomedicina, and I look into that, and I'm thinking, look, there are some case reports here, people that are on the carnivore diet that have cancer and they're incurable, but they're cured. You can't say that in the United States, right? But you can say that in Hungary. Hungary. So I'm looking into it, and it makes sense. And I started January 1st, 2020, and I am doing it strictly. I mean, at least for, I would say if I cheat, you wouldn't call it a cheat. So I am strictly adhering to this carnivore diet, and especially a 2-to-1 or greater fat content based on grams, because I am trying to be in ketosis as much as I can. Now, the reason is that cancer is not a genetic disease. It is a disease of metabolic dysfunction and mitochondrial dysfunction. So I know that I can address this metabolic dysfunction by eliminating at least 50% of what these cancer cells want to eat, and that's the glucose. I can't get rid of the glutamine, and I don't want to do that, and I can't do that. Thomas Seyfried says there are ways to do it. I'm not so sure I can do that, but I can control this glucose on a carnivore diet if I'm living in ketosis. And of course, the Medicina Clinic is telling everybody that everybody can live on with ketosis throughout their entire lives. And certainly their medical patients are getting results that no one is getting without other medicines, strictly on this diet that they call a Paleolithic ketogenic diet.
Which is really a higher fat carnivore diet. And I'll get into all that, and we can talk about.
Yeah. So the carnivore diet is my way to eat. Yeah. So they nuance it too. And they say you need to be at least on 70% carnivore, and you can have up to 30% healthy vegetables if you want.